to push back on really harmful stereotypes. The people who need access to medical assistance and who need access to SNAP are our friends. They're our friends' kids. They're our neighbors, our colleagues, our parents and grandparents. You know, it is really up to us to make sure that we share these stories out, because I don't know about any of you, but you know, $30,000 for a single treatment, right, Kristen, at a hospital, even $14,000 to $15,000. I don't have that laying around. Does anyone just have like $14,000 to $30,000 just laying around? I didn't think so. Somebody said no. I didn't think so, but that's life-saving care. And that is the sort of thing that access to medical assistance through the Medicaid program really does provide people with. And it's these things are life and death, like life and death. So thank you again for sharing your story. So Kristen, I'll do as a segue here, Kristen lives here in Northampton County. So next, we're going to hear from Northampton County Controller, Tara Zirinsky, to talk about the community-wide impact that these programs have. Tara, go ahead.
Right. Hello, everyone. I'm really glad that I had the opportunity to speak with you today, because this is something I'm deeply committed to and deeply concerned about.
Can you put the mic closer to your mouth? Yeah, just put it closer.
Closer to your face.
Yeah, so put it right up.
All right. You know, most of the time people tell me I'm too loud.
What's in the back?
Right up.
Put it right up to your mouth.
All right.
There, now we can hear
Good.
you better.
Yes. Okay. I'm not looking. Maybe don't laugh. Yeah. Anyway, what I was saying is that I'm very much concerned about this for two reasons. When you look at the cuts that are being made, they impact for SNAP our children, our neighbors, our colleagues, the people that we're next to right now could be somebody who has used SNAP. You don't know everybody's story. I can remember a time when I was counseling this young woman, and she came into the counseling program pro bono. And she had been on disability services, but she really wanted to work. So she got a job. And do you know what happened when she was making her $10 an hour? She lost her benefits and she couldn't afford food. And you think to yourself, this isn't a program that is just to sustain people. This is a program that people need. It's a moral imperative to feed our people in our community. And I just can't understand how these cuts can be reconciled with any compassion. And it pains me to think that people in our communities, and I want to focus on Easton for a second because that's where my office is, and that's where I got this statistic, but over 22% of households in Easton are SNAP recipients. Now think about that for a second. That's almost a quarter of the population. And those are the people that apply for it. Who are the people out there who have not yet been able to access it because maybe they don't know about the program? They're too proud to be part of the program, or they just don't have the ability to navigate their way to that office. These programs need outreach, they need funding, and we can't do that if the federal government is going to install these cuts. I think about the people that they're going to hurt, and I know those are the people that are the most vulnerable in our community that we should be lifting up. That is what my moral compass says. And now I want to switch a little bit to Nazareth and talk about Graysdale. because I'm really concerned about that. So nursing home facilities are funded almost 64% by Medicaid. 64%. Now, Graysdale in itself is razor thin in its budget. When I look at the financial statements and I go over to that office, they tell me, and I see that it's going to be a difficult year next year for the residents at Graysdale. And what happens? You cut services, you deny treatment, alter benefits. Maybe some residents won't be able to live there anymore. I know how hard it is to apply for Medicaid because I applied for it when my mom passed so that she could have residence in Graysdale. And even at Graysdale's prices, low as they could be, subsidized by Medicaid, if she would have had been transferred to another facility, I think my father probably would have lost his house. And so you think these benefits aren't just protecting people when they're ill, they are also protecting the spouses and the family that are left behind. Could you imagine a person so scared that in their moment of trauma, when their spouse dies, that they have to think, oh my God, am I going to have a place to live? Wow. And that's what these cuts mean. They have real consequences, real unintended consequences that this administration and this Congress are not thinking about. And that just breaks my heart. So that's why I'm here today to speak about this.
Thank you. I think we all feel that sense of outrage at times, right? Who doesn't know a family that has been in that position, right? I saw on the way here, I came down from Bloomsburg to be here tonight, and on the way in the last 15 minutes or so, I saw 2 billboards that said affordable memory care, 1 month free. And like, that's pretty messed up, right? Like the commodification of all of these things, and it's just predatory. Like it's really, these are predatory systems that ignore the real human impact of what families are going through. How do you get to the next step in your life when you are faced with those questions about how do you pay for a loved one's care? How do you make sure that everyone has access to the food that they need? One thing that the controller brought up that I think is a real thing that we need to highlight here is the impact that these potential cuts would have on what are already our most vulnerable communities. It's always difficult when we're talking about these things and we talk about the numbers and we talk about how many millions of dollars and billions of dollars can be cut. But those cuts hurt the people who are already struggling the most. So to talk about the impact on some of these vulnerable communities, I'm really honored to introduce Corinne Goodwin, who is the Executive Director of the Eastern PA Trans Equity Project. Go ahead, Corinne.
Thank you. Y'all can hear me okay? Usually it's not a problem for people to hear me. So I want you to look around the room here just a little bit. And I just did a really rough head count because counting is hard for me. But especially when everybody's like at the same level. But there's about 75 people in this room. Okay. And half of you, statistically speaking, live below what's called the ALICE line. Does anybody know what ALICE stands for? One stands for asset limit. I think it's because I told you. Right? Asset limited, income constrained, but employed. In other words, you're part of the working poor, right? You're the people that you get down to the end of the month and you have zero left in your bank account, right? There's nothing left. And you're the folks, half of this room statistically that are unable, you are one blown transmission away from disaster. You're one medical bill away from disaster. You're one anything away from disaster. Broken refrigerator, broken washing machine, plumbing problem. Last week it was so cold, lots of people had plumbing problems, right? Frozen pipes left and right. But I want to talk just a little bit about the transgender community because that's who I represent here on a day-to-day basis. So nationally, and this isn't even the Alice line. This is the poverty line. So this is what Kristen was kind of talking about. You're that minimum wage worker making $15,000 a year. Over 30% of transgender people in an aggregate live below the poverty line. And if you're a transgender person of color, that number is closer to 60%, right? So if you're Black, if you're Latin, if you are an immigrant, right? And you're a transgender individual, you have significant issues with your income. You have the inability to get housing. 21% of all transgender people who have housing, when they come out, they are kicked out of their housing. 30% of transgender people have been homeless at some point in their life. That number in the Lehigh Valley here is over 40%. You think about hunger, right? 27%, this is an old number, so this is from 2015, the National Transgender Survey, but 27% of transgender people in 2015, when the economy was really running well, went to bed hungry at night. They didn't have food in their belly, right? That number, right, and by the way, again, that number was double for transgender people of color. You can't go to work and you can't go to school if you don't have a roof over your head and food in your belly and electricity to charge your phone and your laptop. You're simply not going to succeed in today's society. And these programs, SNAP and Medicare and Medicaid, literally save people's lives on a day-to-day basis. Just kind of a couple other numbers here. So in the state of Pennsylvania, we kind of did some math there, right? So there were 1.3 million or something like that people that were on Medicaid, Medicare, that was yeah, that was about 15% of the state's population. I did some really quick math, which I'm bad at. But about 15% of the state's population rely on Medicare, Medicaid, or the ACA. For transgender people, that number is 32%, right? These programs literally are life and death for people. Earlier today, I paid rent for a person in Lancaster County who they came out. They were working in a coffee shop for like $12 an hour. They came out and they were fired, right? And they were already living that paycheck to paycheck life. And they were, this far away from getting, being on the street. And once you're on the street, getting off the street is really hard. We look here in the Lehigh Valley, for example, and these, we have, homeless shelters and warming shelters. Many of them will simply not take a person of transgender experience or a queer person in general. Like you just can't, they won't take you, right? On religious grounds, right? So we need to really be thinking about how these programs, whether it's SNAP, so actually the person who I was talking to today, during the pandemic, they were getting $290 a month in SNAP benefits. They've been reduced post-pandemic to under $20. I don't know what you do with $20 worth of SNAP benefits, but you can't do much, right? This is why, last year we paid over $130,000 in financial assistance just to keep people alive, right? And so, I really want you to be thinking about, two things here, right? And not to be kind of staying on the transgender thing, but, statistically, half of you in this room are one blown transmission away from disaster. You're one emergency room visit away from disaster, right? And that's a tragedy. We were talking about the work requirements, right? And how what they really do is that they they create harm because they move you out of Medicare, Medicaid eligibility, right? Well, the same thing goes for like the EITC tax credit, right? So the tax credit for people who have kids. During the pandemic, they changed the rules and they said, we'll pay that out every month. The people who got the earned income tax credit last year, you'll get it paid in a monthly check. Since the pandemic, it's now gone back the other way, and you have to wait a whole year before you get that money back. During the pandemic, overall childhood poverty was reduced by like 50%. And now it's going back up. And I really want you to think about this as we have a shrinking population of young people and a growing population of old people like me. I just got my Medicare card. I was so proud. I literally threw my back out the same day. Totally connected.
From celebrating, getting your card.
Yeah, right. But I mean, we need to be really thinking about that. When you have folks that are falling below the poverty line, right, who are falling below the income line for getting, or coming right up above the income line for getting Medicaid, Medicare, right? That means that they're going to be unable to pay into Social Security and Medicare for you right now, right? So this isn't just about, the poor people, right? This isn't just about, the people of color. This isn't just about the transgender queer people. This is about you and our ability to sustain an economy that allows you to have the benefits that you have right now, maybe as a Medicare recipient or as a Social Security recipient or recipient of any number of other government type programs. So I really urge you to be thinking about speaking to your elected representatives at every level of government, right? So, municipal, county, state, federal, Mr. Fetterman, right? Mr. McKenzie, right? It's easy for us to go, well, Ryan McKenzie isn't going to listen. You know what? The one thing politicians are most afraid of is getting unelected in the next election. And so if we had, 75 people walk into Ryan McKenzie's office tomorrow and say, you got to freaking figure out a way to save Medicaid and Medicare and make sure that people can eat and people can stay housed and the kids can do their homework and go to school, he would start thinking twice about it. And if all 75 of you sent an email to his office every month, he would start thinking about it, right? Same thing, at your local municipal level. If you start making noise at your municipal level, they're going to start calling Ryan McKenzie, right? And saying, like, we got to do something about this, otherwise I'm going to lose my elected position, right? It goes all the way up the line. So this is, the opposite of trickle down. This is like, from the ground up. And, I'm just going to say that my folks right now are in tremendous amount of crisis, not just economically, but socially. And I need your help. I need your help to support them, because otherwise we're going to run out of money and we're not going to be able to save that person, whether that one blown transmission away from being on the street. So I'm just going to count on you for that.
Thank you, Corinne. And thank you for the work that you do. It's so important and so absolutely needed. So thank you. Corinne gave me two great opportunities. One is to say, we really do appreciate the participation of, someone from Senator Fetterman's office. I will say that the coalition here that's working did reach out to Representative McKenzie's office multiple times and have not received a response. So does anyone think that that's okay? I'm guessing probably
I
not.
have his phone number if anybody wants. I call him every day.
Well, we will come back to you in just a little bit. But I think the other thing that Corinne pointed out is, like, these issues are all connected, and everything is an economic issue. So this is a great opportunity for me to hand it over to Mark Steer to talk about the impact that these things have on not just spending at the federal level, but on our state budget and how, I don't know, maybe a fair tax system could also really help all of us, because I don't know about anybody else, but I don't love the fact that billionaires pay less in taxes than most of us in this room. So I'm going to hand it off now to Mark Steer, Executive Director of Pennsylvania Policy Center. Thanks, Mark.
Thanks very much. I'm really glad to be here, and I want to thank all of you for being here. Some of you got a text from me at halftime of the game yesterday. Maybe that's why you're here. Because the game came out right. We have to make sure that Medicare and Medicaid and our tax system comes out right.
Go Birds.
That's what the text said. I am a policy analyst, but before I get into the details of public policy, I do want to tell a couple of stories about people who have been on Medicaid. First, my mom. Well, my mom was not quite on Medicaid, but when my dad died, we brought her down from the Catskills where she lived, found her place in an assisted living place, and it was very nice, and she said, I can't afford this. I mean, I can afford it for a year and a half, and then what am I gonna do? And then the nice woman at the assisted living place said, well, you can go on Medicaid, and it'll cover you. She said, oh, and that was such a relief for her. They did tell her you'd have to move into a double room, which she wasn't happy about, but she was gonna do that, but my mom being my mom died before that happened. So, but it was an enormous relief for her, even though she didn't have to use Medicaid, to know that it was there for her. My daughter just finished graduate school in social work. She's been on Medicaid for the last couple of years while she's in school, because that's how kids going to school, graduate school, get health care, because most schools don't provide it anymore. My wife is teaches at Drexel Medical College, and most of her students are on Medicaid. So the doctors, the social workers, graduate students, and all kinds of people, lawyers, they're on Medicaid now, and that's helping them get health care while we're training them to go ahead and be in whatever career they're working towards. So Medicaid benefits a huge number of people in lots of different ways. Now, when it was started in 1965, it was really the poor sister. It was an afterthought to the Medicare program. But as is typical in America, we start programs and then we gradually expand them. Some of you may not know, in 1938, the first class of Social Security recipients, there were like 17 people. That's a bit of an exaggeration, but it was very low. And we gradually expanded the Social Security program, so almost everyone who's over 65 can get Social Security. We've created a program that benefits huge numbers of people at very different points in their lives, and that is also the most efficient healthcare program that we have. Of any program, it costs less to provide some of the best care we have. And it costs the government less per procedure or for care than Medicare does. It costs less than private insurance does, and it provides very, very good care. My daughter said, am I gonna have to go off it now? I'm gonna get a job. And she's disappointed because she's had private insurance and she said it wasn't as good. Now, before I go on, I want to make a very important point. No one in this country gets health care without some public support. Absolutely no one. Many of you probably have employer-based health insurance. Are you aware that that insurance could be considered income, but it's not taxed, and provides an enormous subsidy for your health insurance. If we did not provide that tax subsidy, businesses would not include it in what they offer people. Now, what about those billionaires? Say you're a billionaire, you can pay any kind of health insurance. But what if you get sick with a rare disease? You could have $100 billion, but you can't, with that $100 billion, do the research to cure you of that rare disease in the time it takes to save your life. Even billionaires are dependent on the research that the federal government pays for with our tax dollars, that the hospitals and the doctors that are trained with our tax dollars. That means everyone is relying on tax dollars. The idea that we would throw some people off publicly supported health insurance when everyone, including the billionaires, relies on it is simply absurd and fundamentally immoral. And that anyone's gonna propose kicking people off health insurance, particularly Medicaid program, is just astonishingly evil. And I think we need to be making that point very, very clear. Now, people told you a lot of numbers, and I'm just gonna add one other number that 400,000 seniors in this state are relying on Medicaid for long-term care, either nursing homes or assisted living. All told, it's almost 4 million people. It's really about a third of the state. Now, that's a lot of people, but it actually understates the number of people who benefit from Medicaid, because what most people don't know is most people on Medicaid are on Medicaid for a very short period of time. You know, if you're on a nursing home, assisted living, you're on it for a couple of years, then you die. If you're lost your job, you're on it for a couple of years until you get a new job. If you've had a real health problem and you can't work, again, you're on it for a couple of years till you get off. Almost no one is on Medicaid for more than 4 or 5 years in a row. Now, if you think about it, if 4 million people are on it at any one time, yet most people are only on it for a couple of years, a huge numbers of people will be on Medicaid at some time in their lives. And in fact, it's hard to estimate this. The best that we have is that 2/3 of Americans will benefit from Medicaid at some point in their lives. So we're not just talking about the 4 million people in Pennsylvania. We're talking about the 8 million people in Pennsylvania who at some time in their life are going to need Medicaid, and if it's not there for them, they're going to suffer. And if we cut back the expanded Medicaid saves 2 people a day in Pennsylvania from premature death. I don't have the numbers right, if you got rid of all Medicaid, but expanded Medicaid, which came along with the ACA, that's one of the things that is most likely to be cut. It saves 2 people a day who would have died without it. And that's unconscionable. And one other thing that benefits, our hospitals. We're going to put out a map next week that shows the percentage of people in every county who is on Medicaid. And if you look at that, the T, across the northern tier in the middle of the state, those counties are mostly 30% or more. And then we've got a plot on that chart where the hospitals are. Most of those counties have 1, maybe 2 hospitals. Many of them do not have any hospitals. Hospitals in rural Pennsylvania have been closing. I think we lost 4 of them last year. It's a real crisis. Scranton General may even close. If those hospitals do not have, they still have to take care of people who come to the hospital sick in an emergency room, and they may not get paid for that. Hospitals, if they cannot get paid for people who cannot afford health care, but they have to carry out that health care, they are going to close, which means all through the northern tier, the middle of the state, people are going to be farther and farther from hospitals. Now, people women who are pregnant, sometimes they have to go an hour and a half to deliver a baby. My wife went from 0 to 10 centimeters in about 10 minutes. We never would have gotten anywhere if we had to go through that. It was just, it's a crazy situation. And I think about that every time I look at that map of how far it is to get to a hospital. So again, it's not just benefiting the people who have Medicaid. It's benefiting everyone who relies on a hospital, because even in urban areas, Hahnemann closed in Philadelphia 2 years ago. The hospital that provides the most care for low-income folks. Medicaid goes Temple. Einstein may go as well. And and you know how hard it is to get an appointment with a doctor now. We lose the hospitals, we're all going to suffer. Now, why are they doing it? We haven't talked much about why they're doing it. They're doing it to pay for Trump's tax cuts. The 2017 tax cuts mostly benefited the very richest people in the country. I think, did we put a chart on that? Yes, we did. The data is down at the bottom. The people making in the top 1% got $35,000, $40,000 in tax breaks. People in the bottom 20% maybe got $80. People in the middle may have gotten $800. Wealthy corporations saw the corporate tax rate drop from 28% to 21%. and got all kinds of new loopholes. It added trillions of dollars to the budget, deficit over 10 years. It did almost nothing for the economy. It did not create new jobs. It did not raise wages. It didn't raise investment. It did almost nothing but give handouts to the richest people in this country. Now, the corporate tax cuts are still in place, but the personal tax cuts for the rich people and will expire at the end of 2025. But because of rules in the House and the Senate, and because some Republicans will not vote for tax cuts that Trump and the Republican leadership want, if they add too much to the deficit, they're okay with adding $2 trillion over 10 years. They don't want to add $4 or $5 trillion over 10 years. So they're insisting that we pay for those tax cuts. And the biggest way they're going to pay for those tax cuts is by cutting Medicaid and SNAP. They've taken so far Medicare off the table and Social Security off the table. They have to pay the debt, and they want to put more money into defense. So the only thing that's left of any substance, that's a lot of money, is Medicaid and SNAP, and they're going to go over them pretty heavy. We don't know exactly what they're going to do right now. It could be reducing the federal share of the state cost for the expansion, which is 90%. Could be reducing the federal share of traditional Medicaid, which is 54%. It could be capping how much we spend per person, as if you only get so much care and then you're done, because the federal government says that's the cap. It could be all kinds of different things. They're figuring it out right now. The Republicans are in Florida meeting to try to figure out what they can agree on in a reconciliation bill that they're going to run sometime in the next week or two, if they can reach an agreement. We're hoping they don't. The longer this goes on, the more we can educate people, the more we can contact our members of Congress, the more we can stop it. And that's the critical thing. Our goals here are, number one, to try to stop it. Number two, to make it less bad. Number three, maybe we can get something good in it, because in 2017, when Trump did the tax cuts, we expanded the child tax credit, and there are a couple of Republicans who actually like that idea, so maybe we can make it better. But the most fundamental thing we have to do is we have to get people to understand how bad this is going to be. And we've done that. In 2017, the Trump tax cuts were deeply unpopular in Pennsylvania. And that's because of the work of some of the people up here, and many of you as well. If we can educate enough people about what Trump and the House and Senate Republican leadership are trying to do, we may make it less bad. We're not going to stop it. They are determined to make those tax cuts for corporations and individuals, extend them. They're determined to cut Medicare and Medicaid, but we may be able to make it less bad. But we can at the very least make people understand what they are doing and how seriously immoral and unconscionable it is. And because if we do that, in 2 years, assuming we still have fair elections and we don't have National Guard folks at every polling place, on the pretext that an undocumented immigrant's going to vote or something like that. If we can vote in 2 years and they do half of what they intend to do, they're going to lose the House of Representatives. They're going to lose Senate seats. And then maybe we have a chance to save this country from the direction it's going. That's why this is all so important. That's why we need your help to contact Congressman McKenzie, contact both your senators. I think we're okay with Senator Fetterman, but I'm sure he wants to hear from you as well, because he, like Bob Casey, I think, wants to go to the Senate floor and say, my constituents are demanding that I vote against this. And if we do all that, we will make it less bad and we will make it deeply unpopular. And that's how we take this country back. Thanks.
Thanks, Mark. Mark also set me up for a perfect segue to introduce. Don't mind us. We're working out all the kinks up here. To introduce Sabrina McLaughlin-Willinsky, who is a regional representative for Senator Fetterman's office. And one thing that I'll say, when folks from the Pennsylvania Policy Center and the Pennsylvanians Together Coalition, of which Action Together NEPA is a proud member, and I want to give a shout out to Dwayne Heisler, who's over here, who has really done an amazing job putting these events together and this campaign together. We have had really great support from Senator Fetterman's team. We've had responses from some other elected officials, but as we mentioned earlier, not from all of them. So it is going to be up to us to put the pressure on your elected representatives to make sure that they know that you care about this issue. So now I will hand it to Sabrina. Take it away.
Good evening, everyone. So, regional representative on staff with Senator Fetterman since he took office for 4 counties. My region is Berks, Lehigh, Northampton, and Schuylkill counties. I'm a lifelong Pennsylvanian. I live over in Schuylkill County right now. I'll give a shout out to my former bosses too. I worked for Congressman Susan Wild for 4 years prior to this role, and 6 years with Congressman Matt Cartwright. So my roots here go pretty deep. You know, before, like I'll say too, like my point or like my purpose to be here tonight for you is twofold. Number one, to listen and gather information from you and learn from policy experts and analysts like Mark. And to take that back to our senior staff, our policy experts on healthcare and Medicaid and Medicare, so that the senator can be informed. Secondly, how can you help me help you? It's communicating and giving us as much feedback and as much information as you can about the impact that this is going to have on your life. All right, so like concrete examples of how this is going to harm your communities, how this is going to harm you personally, how this is going to harm people that you love, so that the senator can take those stories and even, you know, sometimes we talk about in reverse how people can like glaze over at numbers. We need numbers too. We need data. If you are a leader in your community, if you're talking to stakeholders, if you work in the healthcare sector and you're hearing from your friends who manage hospital systems, who are trying to run hospitals, about how this is going to impact them, please, we need you to communicate that with us so that we can highlight it as much as we can. As we were preparing for this event tonight and in trading emails and communicating with each other, getting ready for it, Dwayne reminded me of a quote from my boss where he promised always to, in his words, jam up any legislation that would cut either Medicaid and Medicare or SNAP. And he's been consistent and clear, I think it's fair to say, and vocal about that all throughout his political career. You know, regarding that promise, I have some good news and some bad news. I will end with the good news. The bad news is right now, obviously, my boss's party is in the minority. So bad news is if they try to make cuts to Medicaid, they will very likely have the votes to do so. The bad news also is that anything legislatively that can be done to address that by any opposition, writing bills to try to, you know, fix it, that's probably not going to happen for the next at least 2 years either. The good news, I said I would end on the good news because someone reminded me earlier tonight that though things are looking kind of grim as far as the power that we do have, just because we don't have as much power as we would like to prevent some of these things, it doesn't mean that we don't have any power at all. So the things that we can do, you know, my boss does, the senator does have a platform that he can use to you know, convey what I asked you to give to us. Articulate that impact that this is going to have on his constituents, how this is going to hurt and harm his constituents if they act on some of these plans to the extent that we are seeing plans that they may. Also, you know, even though the senator is in the minority right now, he works with folks who are in the majority. So communicating to them in his role as your advocate, how this is going to harm and hurt their mutual constituents. That's an important role that he can play and that we can play to assist him going forward. So, you know, over the next 2 years, in the short term, I think, you know, we will want to, as much as we can, still be that vocal, consistent, and clear advocate for not cutting this program. And I'll just end on these programs. I'll just end on a personal note. Tara and Mark also spoke about this, but my own mother is a Medicaid dependent nursing home resident. Okay, she's a 65-year-old dual enrolled Medicare Medicaid recipient. She has no assets. She gets $300 roughly in Social Security each month. She is in a Medicaid bed in a nursing home facility. I'm concerned personally that if we see some of these cuts, how are nursing home facilities going to respond? Because anyone else, and I think many of you probably are in the audience like me, have guided your elders who may be Medicaid dependent in finding Medicaid beds in nursing homes. We all know not every nursing facility offers Medicaid beds. Like, they're not required to do that. The ones that do, thank God for them, but are they going to be making some hard decisions about cutting those beds? Will you see, you know, even fewer assisted living facilities and nursing facilities to choose from when and if any, like you yourself or anyone in your family needs you know, skilled nursing care? So it's something that's very much on my mind personally. And thank you all for being here. And happy to chat a little bit with anyone afterwards before we all go home.
Thank you so much, Sabrina. And again, I want to just please ask you to extend our thanks to Senator Fetterman and also the ask that I'm sure is shared by everyone in the room, that he does use his sizable and very public platform to lift up the stories of his constituents and the needs of the people throughout the Commonwealth who desperately, desperately need a voice in this fight. We are counting on him to do that. And he's got the megaphone to do it. So we hope that that's what he decides to focus on. Before we move into some questions, because we went, I'm going to switch it up just a little bit. Before we move into some questions, we're going to have group fun time. On your table, you will see, no, not that. On your table, you will see from our friends at the Pennsylvania Policy Center a flyer that you might have been handed, and they're also on these stand-up things on your tables. Does everyone here have a cell phone? Does anyone not have a cell phone? If there's anyone who doesn't have a cell phone, you're exempt, but everyone else, we're going to expect to do this. On those flyers, you will see a QR code that you can scan with your phone. Oh, thank you, Mark. Mark is going to be my Vanna White right now. If you look on those flyers, you'll see a QR code. That QR code, if you scan it with your phone, and some folks are walking around the room who can help you if you might be having trouble with that. If you take your phone and scan that, it will take you to a petition. We're going to do it. The panelists are going to do it right now. This is amazing. It's happening in real time, everyone. So we are talking about the flyer that says Federal Fight Back across the top and has a QR code that you can scan. We've got people roving around the room that can help you. Now, when you scan it and you get there, and if anyone needs help, raise your hand, and one of these amazing human beings who are walking around can help you. These are all on your table, but we're passing out some extra copies. That is a petition. And actually, Mark, would you like to just tell folks, what the goal of this petition is?
So the petition basically is to members of Congress, House members and senators, ask them not to cut Medicaid and SNAP to pay for tax cuts for the ultra rich and wealthy corporations. That's the short version of it. have a feeling we went on a little longer, knowing our organization, but that's really what it is. What we're gonna do with this petition is we are going to copy it, make copies of it, and send your names. Everyone who signed it to Senator Fetterman, to Senator McCormick, and we'll figure out, we'll know what House district you're in. We'll send it to your House number. For most of you, that's probably gonna be Ryan McKenzie. So that's who we invited to this meeting. And that's it. It's part of it. It's one of the critical things we do to help get our members of Congress to understand that people care about this issue and are gonna know what they do.
Thank you, Mark. Is anyone still having trouble, or do you need the flyer to scan and sign the petition? I think it looks like we're in pretty good shape. I want to thank my colleagues and our friends with the Pennsylvania Policy Center who are walking around just helping folks. But I want to do that just because this is one of the goals here is to, there is strength in numbers, right? There is strength in numbers, and having, 70 people fill this out tonight is a huge, huge step in getting this ready to go to our elected representatives. So thank you to everyone for doing that. What we would ask, take these flyers and have other people in your life fill out that petition. You can share it on social media. Once you actually pull it up and scan it, you'll have a link, and I think it prompts you to also share it. So please do that, because those numbers really do help when we're then submitting these things to our elected officials. Speaking of those numbers, one thing that I forgot to say at the beginning, and then we're going to open it up for some questions from all of you. If you did not sign in with my amazing friends who are at the sign-in table, please make sure that you do sign in so we can follow up with you. We're also going to be, again, asking for those stories, so we want to be able to know who was here and who we can reach out to. I know Michelle raised her hand in the back. If you haven't signed in, see Michelle. She would love to get you signed in. She would love nothing more than to get you signed in. Okay, so now we want to open it up. In the time that we have remaining before we close out, who has questions? And I think we have a wireless microphone that was over here. If you think he needs.
I don't need one.
Okay, we'll repeat his question. I know we have a few folks who are having some sound issues, so we'll take it over here. And if you do have a question, when this gentleman is done, go ahead and raise your hand and we'll come to you.
So my question was, I assume that there's people who are receiving benefits in Pennsylvania. There's also people that voted Republican, not just people that voted Democrat. Is there any data on how that splits out?
We don't have
Hold on, so I want to repeat the question. So I think the question is, do we have data on how it divides out for who voted for whom and who these cuts would impact?
Yes.
So I just want to make sure everyone heard the question, then I'm going to hand it right to Mark.
We don't have data about the party identification of everyone on Medicaid. We do know that rural counties have a higher percentage of people on Medicaid than suburban counties, and even a little bit higher than most of the urban counties. So those are the counties that voted for Trump and voted for Republican members of Congress. I'm sure there are plenty of Republicans who are getting Medicaid.
Yeah, it seems like a no-brainer. Okay.
And one thing that I want to point out, the panelists were having a chat, before we got started, and I think Tara, it was you that said, this should be a bipartisan issue, right? Does whether or not your mom needs to go into a nursing home, does it matter if you're a Democrat or a Republican? It sure doesn't, right? If you need to buy food for your family and you're struggling to do that, does that only impact one party or another, right? And the answer to that is, of course, no. So highlighting the fact that it does take us coming together as a community and helping people understand the impact of these policies and the impact of their votes does really matter. We had a question over here, and then
Sure, we'd like to use the microphone because there are two folks that are hearing impaired in the room. So we want to make sure. Something like that.
This one also.
See, this works really well. Just put your mouth right here. It's not right.
I need to find something more relaxing than my last job.
Hello, test, test.
That is-
You have to hold the mic.
Well, no, this is on. Just, hello, test, test. How about if I stand up? Test, test.
Oh, yeah.
Test,
we
test.
got that.
Can you hear me now?
Yeah.
Okay. This may be an obscure question about Congress, but knowing the age group of our Senate and House representatives, how many of those folks would lose their Medicare if this goes through? And we know politicians don't like to take money out of their own pocket. You know, so is that going to occur with them as well?
At the moment, they have not, they're not planning to reduce Medicare. I think that could come in the future. And I don't, no members of Congress are on Medicaid. Plus, they get really good health benefits as a member of Congress. In fact, Ryan McKenzie, I don't know if he did 10 years and he vested. Ryan McKenzie, if he did 12 years in the Pennsylvania House, he has the best possible health care. When Charlie Dent was a member of Congress, he kept his health care from the state because it was even better than the U.S. Congress's health care. State representatives and senators have the absolute best health care you could possibly imagine.
What about their families that are on Medicaid?
If their families are on Medicaid, they're gonna get hurt
Is there
too.
statistics?
We don't know whether family members of Congress are on Medicaid.
I think we have a mic figured out now. This one's live and by itself. Where can I?
We are going up here next, yep.
All right, so I'm not,
Just talk right into it.
okay,
There
all
you
right,
go.
So I'm not sure exactly how to take advantage of this. But when you're talking to your congressmen, it's best to try to get into their mindsets. And with Republicans, when they're talking about getting rid of funding for Medicaid, Medicare, that kind of stuff, talking about socialization. And right now, they're also talking about spending $300 billion with a B on buying TikTok. So, you know, try to use that knowledge somehow. Any suggestions
There's
on
no
how to
logic
take advantage
there.
There you go. Thank you.
So I'll just say that, you know, and I spend more time talking to politicians than I would prefer. All due respect. But it's that, so there's kind of, at least in our community, there's a saying is like, you know, there's nothing better than moms and kids, right? When you're talking to a state rep, for example. But is that you always want to start off with the story, right? So you start off with a story talking about, you know, your family and how, you know, and you're concerned, we heard tonight, right? You know, the potential of, you know, you losing your health care, or the fact that you had to raid your kid's college fund to pay for health care, or that your next door neighbor, you know, is lost their single room in the nursing home and now is in, you know, a warehousing situation potentially, right? You start off with that story, and then you back the story up with the facts, right? So the key is to get, you know, that representative or the representative staff engaged. And by the way, you often do better with the staff than you do with the actual politician. You might get more time with them, more face time, but, you know, start off with those stories to get that kind of emotional buy-in, and then you jump into all the facts and go from there.
You know, what I don't understand is why we're not all advocating for Medicare for all. Because at this point in time, if you don't have an employer that provides health care, or you can't afford it through a state program, or you don't qualify for Medicaid or Medicare, you don't have insurance. So many people that I know are uninsured or underinsured. They're only insured for something catastrophic, so they never go to the hospital. They never go to the doctor for a well visit. Up until I became controller last year, I didn't have insurance. And you know, this year, I went to the doctor, I got a mammogram, and I have not gotten the colonoscopy, but, you know, apparently that's on the table because I'm that age. But my point is that we have to start asking our politicians for more. If we are okay contributing to a GoFundMe from somebody whose child has gotten hurt or from somebody who needs a heart transplant, we can be the caring community that provides health care for all. And that is a conversation that we really need to be having.
Preach. Absolutely. Yeah, Kristen, go ahead. I think there's one. There's one.
No, thank you for raising that, Karen. I totally agree. It's long past time to see a single payer or Medicare for all system. I did just want to give a shout out to Representative Bob Freeman. Because Representative Freeman has a bill that is a step towards that, which would allow people in Pennsylvania to buy into the state employees' health insurance plan. The health insurance that Mark was talking about, that our legislators in Harrisburg get to access. We would be able to buy in under his bill for a certain percentage of our income every year and access the same health care. So there are people who are fighting for, you know, the steps to get us towards that change. We just need to have their backs and push for it.
Yeah, that's a really great point. Okay, we have a couple questions over here. Oh, someone has the microphone, so you're first, and then we'll go you, okay?
Yeah, so my question and concern is, this is gonna happen regardless, right? It's just to what degree the outcome will be. Clearly, I'm assuming most of us didn't want 47 in office. It happened. He's making some drastic, major changes very quickly, this being one of them. But my question is, when this takes place, for those people that are mentally challenged, for the seniors and nursing homes, just everyone, what's going to happen to them? Where are they going to go if these nursing homes no longer want to have Medicaid beds? The mental, well, we don't even have mental health facilities, right? So where are these people going to go? We already have a homeless issue as it stands. Affordable housing is a joke. So what is in place, or what could be put in place, most likely on the state level, to help these people?
Well, yeah, so I just want to say what's going on here in Northampton County. I just talked to Dr. Pitaro, who is the head of corrections in Northampton County. When I went over to the prison, I asked him, who is the population here? You know, and it's not drug users. It's not that kind of population. It is mentally ill individuals. And these individuals, because they've probably lived a life in between houses, in and out of jail, are also some of the most vulnerable and ill individuals, like health-wise, not just mental illness. That is a tax burden on every citizen in the county. So we could suspect that some of those numbers will go up. We could suspect that some individuals are just going to be aging in place and dying in their homes. Because people are going to have to make really tough choices. Do I put my person, my spouse, my partner, my significant other, whatever, into a nursing home, or do I keep them home because I'm not going to be able to afford it and I won't have a home when they pass?
That's for those with family members or friends that care.
Right.
There are a number of people in jail in these nursing homes that have nobody. You know,
Right.
people
Well,
in their
we know that the homeless population is going to rise, and that's going to require more shelters, more beds, more
emergency services in general.
Yes,
You know, because the
but
police
that's
are gonna
all
be
part of
busy.
it.
Yeah.
So I totally agree. We're going to see that impact. We're going to see homelessness. We're going to see more people show up in the emergency room department, and that's going to be their prime point of care. I think in general, too, we can also look back to the Medicaid unwinding at the end of the pandemic. for examples of what is going to be the real world impact. And I was one of those people, so I can say from personal experience that the implementation of that, of going from Medicaid into the private insurance market again, was incredibly messy, frustrating, and confusing. I called the county assistance office many, many times, and the people who work in the county assistance office in Northampton are amazing, but they were getting conflicting information from the state. So they would periodically tell me, we'll call the Compass office in Harrisburg. So I would get on the phone with the Compass office in Harrisburg and spend an hour and a half on the phone with them to try to get answers to just simple questions like, okay, when the unwinding starts in, I believe it was April of 2023, do my benefits stop in April? Do my benefits stop X number of months into the year? Am I okay until my renewal date? Because under medical assistance, you have to renew every year on the anniversary of the date when you enrolled in the program. And I got different information from different people because they were doing their best, but they didn't have the information. So to remove this many people from a program takes people. It takes time, it takes money. In some ways, it may even be more expensive because you're going to have to invest manpower and hours to do this. There were about 500 million people who were removed, or 500,000 people were removed from Medicaid in the unwinding. And I looked the numbers up, about 75,000 of those people went to an affordable care plan, like I did. But there were 237,455 people who lost medical assistance, and they lost medical assistance because of lost paperwork or incomplete paperwork. So they were those people who didn't have people to help them. Maybe they're living so close to the poverty line they don't have access to a computer, because most of your application process is now digitized. You have to upload the files. Maybe they were struggling with mental illness and they missed the deadlines and didn't get the notifications. So even with the great effort that was put in when we unwound Medicaid, with local and state officials working together to notify people that their benefits were going to end, and I can say from firsthand experience, I got those text messages and those phone calls and those emails. It still was overwhelming. It still was confusing. There were still nights where we were sitting at the kitchen table saying, you know, are we making the right decision? Are we choosing the right healthcare plan? And that's going to happen to a lot of people if this goes through and be exponentially worse than when we unwound Medicaid.
Do we know the time frame on when they're looking at implementing things? I know he wants to move fast and furious, but is there any type of time frame as to when you could expect?
I'll just say that probably January 1st, 2026. I want to make one other, probably the end of the year. I want to make one other point. The state's not going to come to the rescue. The state spends $48 billion on Medicaid. By the way, we call, sometimes people are talking about medical assistance. For some reason, we call Medicaid medical assistance in Pennsylvania. It's the same thing. Of that $48 billion, 31 comes from the federal government. The state pays $16 billion. There's no way the state can make up that money. It might help a little bit around the edges, but even if they cut, even if it's a smaller cut, if they ended the Medicaid expansion, throwing 250,000 people off Medicaid, that will cost the state between $3 and $4 billion a year. The state doesn't have that kind of money, and even if we, well, look, we could raise taxes and everything in Pennsylvania, pay for it. The Republicans in the state Senate will never vote. So people above 100% of federal poverty line and below 138% that make too much for Medicaid, too little for the ACA, they're just out of luck. People in nursing homes, they're going to be out of luck. People are going to die and suffer and be on the streets. That's simply the reality of it.
I was just going to say, so we kind of think about the higher level or the macro things that are going to happen. So people are not going to be able to access healthcare unless it is an emergency room situation. They're going to go to the ER, and the hospital's gonna have to provide that care for free. That means that the hospital can't be in business anymore, right? To the point of, we have hospitals closing all around the state, especially in rural areas, but to Mark's point, earlier, even in downtown Philly, right? You're gonna have a huge increase in the homeless population, which, people are gonna get upset about the fact that they have homeless encampments in their neighborhood. And that means they're gonna say, well, we have to invest in policing because I don't want it in my neighborhood. And so you're gonna have the policing of people who, the criminalization of housing insecurity, the criminalization of people that are poor, even more than it is now, right? You're gonna have issues, with the decreases in SNAP, right? So what are people gonna do? Well, they still gotta eat, so they're gonna steal, right? And then we're gonna pack more people into the jails, right? Or we're gonna give people criminal records, so they're not gonna be able to get access to employment. And so all of these things start adding up into this, issue of, how do we pay to keep those homeless people out of sight? How do we, so we expand our jails, right? We're still gonna be spending money. We're just gonna be spending money on different stuff, on unhealthy people, right? And on people who are hungry. We're just gonna do it differently. We're gonna feed them in the jails. And that's wrong. That is just dead wrong.
Sorry. First of all, thank you to the panel and for everybody who organized this event. I know I'm learning a lot. I understand there are basically like two things that you've asked us to do. Fill out the petition, of course we did that, and talk to our elected representatives, tell them potentially how things can change. I have a feeling there are many people in this room who would like to know what else we can do. Whether it's from our homes or if I know I'm in a position to volunteer. I see these posters with organizations. I've never heard any of these. Yes, I have the flyers. I haven't had time to read about them. But
She saw my eyes lighting up when she said what else we could do.
really, that's what I came here for.
Sure.
Is to find out what else we can do. Thank you again.
Hello, panel. I'm going to take this one. I think the answer to that is whatever works for you. And I think there are lots of people in the room. A lot of them are wandering around in the periphery there. I see, look at that. I have the most amazing folks just ready to go. Action Together is a grassroots advocacy organization. Our mission is to connect people to things that they can do. So I would say talk to myself. If you work for Action Together or an Action Together member, raise your hand. Look around the room. Kristen, raise your hand. Kristen forgot. Feel free to talk to any of us afterwards, and we can connect you to actions that you can take. I would imagine that the other people up on this panel can also connect you to ways that you can volunteer and take direct action to help folks in your community, to support the mission of the Eastern PA Trans Equity Project. I'm sure you can connect folks to organizations right here in Northampton County. But our goal as Action Together and with the Pennsylvanians Together coalition that we're a part of is to find ways that work for anyone who wants to be involved to find the right opportunity for you. Because it's not one size fits all, right? We all have different time commitments and we're comfortable doing different things, and there's not one answer that works for everyone except hey, everyone in the room, fill out this petition, right? Call your representatives, share your story with Miles. Miles, wave your hand again. There's Miles, look at him. Miles would love to hear your stories about why you're here and what's important about these issues to you. But from there, if you signed in, you'll hear from us with opportunities to take action and do more. Yep.
I want to give you Ryan McKenzie's office number.
Great.
It's area code 484 781 6000. 484 781 6000. I'm told that the answering machine still says Representative Susan Wild.
Whoops.
But it's his office now.
I have his Emmaus number, and that's a different one. I have a 484-575-1872.
Call them both.
And then
Yep.
there's one in Washington, it's 202-225-6411. I call them every day.
Yep. He wants to hear from you. Okay, Dwayne, go ahead.
Yeah, so my name is Dwayne Heisler. I'm the campaign director for the Pennsylvania Policy Center and Pennsylvanians Together. I am so pleased that we're working with Action Together, and they have a chapter that they are spinning up here, as Jeff said, and we partner with them. And I want to just give you a heads up. We're going to be doing all kinds of Zoom calls. We're going to be having other events in this district, and we want to invite all of you. And the best way to invite all of you is if you sign up for Action Together, because we'll be working with them and reaching out to them in order to do that. I can also tell you that personally, I contacted 3 times the office of Brian McKenzie and did not get a response by email. Yeah, just nothing. So it's not surprising they haven't updated their. I will also say 2 weeks ago, we were in the 8th Congressional District, and we did hear from Congressman Bresnahan. He did send staff. He did give us a quote talking about the importance of these programs. So it's really up to them. And if we really want to have an impact, the House margin is so tight right now. If Ryan McKenzie got on the phone and spoke with House leadership, he could tell them this is not for the people in Bethlehem and in Northampton County. So this is why you have to give a call. This is why you have to tell them how important it is. And that's the only way that we can get their attention, because at the end of the day, the House will be putting this together, and you have a representative. All of you do. And you got to make sure that they're listening to you. So I will make sure that Action Together, when you sign up, you can have all of my contact information. I'll let you know when these events are happening. We are going to be doing a lobby day in Washington, D.C. in March or in April. I will let all of you know. We've done them before. We can get you there. We can put you up in a hotel. We'll figure out all of that stuff, because we want to be able to set up these meetings with your representatives so you can have your voice. Because what I'm hearing is you feel that you don't have a voice, right? So please sign up for Action Together. Get on that list. We'll make sure to keep you informed. And right now, you know more than all of your neighbors about what's happening. You are more informed right now before you walked into this room than most of the people in this county. You're aware of this now. What are you going to do with it?
So again, I'll just ask my colleagues who are in the back of the room, like, hold up a clipboard. They are signing folks up to be Action Together members. And boy, would we love to have you on board. I think we were going to take one last question. Actually, Dwayne, I said over here, I believe right there, I think had a question unless we answered it.
I'm sorry, who?
It was right there, right next to you. Look down, there you go.
Oh,
you're good now?
Yes, good.
Okay, then we'll go over here, and that's gonna be our last comment.
One person you have to call is Mike Johnson, the House Speaker. I have his number if you want. And you always say to him after you say this, what would Jesus do?
Clearly they don't
Anybody
care.
wants that
Trump
number?
is in office.
Okay, we will share resources out with those contacts. Before everyone splits, I just wanna again, thank you to all of you for being here. I want to thank Dwayne again for helping, make sure that this event happened. I want to thank my colleagues with Action Together NEPA who are here. I want to thank Miles. Miles wants to talk to you. Miles Payne from Commonwealth Communications wants to hear your story. And thank you to every single member of our panel, Corinne, Tara, Mark, Kristen, Sabrina. Thank you so much for being here, and we will have more information coming on things that you can do. Thank you very much. I would imagine this lovely lady right here can tell you how to contact your senator.
Thank you, guys.
I gotta look it up myself.
Oh, yeah. I think you guys
Dwayne?
Oh, yeah.
Picture, did I lose any cameras? Oh, yeah, that's all. All right, we're gonna do a picture. So,
Okay,
great.
thank you for that.
There we go.
Oh, yeah.
Everybody, back in, back in, back in.
Oh, your phone's a lot better than mine. Can you send this to me? It's a much better phone.
We look at a little bit more, I know, obviously there's a lot going on. But let's talk to you. Okay. For a new Yeah. Gotcha, yes. Yeah. Perfect, thank you. Yeah. I love it's funny. Yeah. You're getting compliments. You're getting compliments.
This is my husband, Jeff.
She's the boss.
That's awesome.
It's actually her story at the beginning was my home. See if she can get on to cover infusion, which is already over, which is 6 months, 6 weeks late.
I like to be really.
I was supposed to have a January 7th.
So we're still waiting for that.
Earlier.
Well, and she's having issues right now with her health insurance because they have said that certain medicine that she needs to have is now available. She's not, and it's not like the supplements. Going with that, which I didn't know. She's the one who got her meds for several weeks, and we don't know what to do. You know, like she's reaching out to her doctor and such.
Stage lines out, I suppose it's not really better than anyone else. Like when people think of SNAP, like yours is the average like consumer can use the same food. So we talk about sure. So seniors like this and they are so restricted. The ability to access I'd be happy to come and
Or anything. Bernie Sanders still needs bus trips.
So,
Going through the northern border of Vermont and Canada. And he takes those off. And he takes the big car down. He comes to Canada. assistants get. So,
Email is best. Our office now. Yep. Anything then, I'll be my job's outreach somewhere.
Oh, yes.
She's been using that myself.
They just now, like, something that the insurance company says, well, you can get that without having to become now. She's trying to say,
Thank you.
it's not this thing, the doctor's insurance that way, and they're still like, going back and forth about it, so she just stopped.
It's a very undue burden. But I just had my neurologist on my had a call, which is nobody other than us.
I do apologize for interrupting everyone. I want to introduce myself. I recently joined Action Together. I was just talking about that earlier. She's just one of those chairs along that one.
I think all the details that she's been on that.
Okay. Well, whatever I can.
Just the stress of not having the
It's a lot for
medicine
the
and
doctors,
that she'll go back.
they are the ones that sad.
My name is Patrice, and I live in Bethlehem. And I came here mostly because I wanted to meet the people who are organizing it.
At the end of the day.
They are, because,
And we're supposed to be caring, but I never got involved in insurance.
lack
When
of
my doctors
wholeness to Bethlehem. But I was told that.
It's kind of is, it's a lot to ask about.
I am. So I should get in touch with you.
Sort of
I was going to
bandage
an email
well, they
tomorrow.
They're not gonna be able to
Hopefully
do that.
not overthink it. She just said I was there. She said, you know, I just organization. Like, the brains and they try headphones.
It is good.
I would love to get together. And I'm sure that you're spaced out, up for no more, but I had email. Yeah, please do. And I just still have my face in front of me. You know him.
So I called.
This is my husband, Jack. Oh, really? I was wondering, he always shows up at like the time where like, oh, okay, yeah, like when sort of like, he did it again, you know, impressed me again, and he always shows up in these places that I came. I thought I would be like, you know, so I can see him from, I'm Bethlehem City Democratic Committee, and I got involved only because I was complaining too much about the Democratic Party, which is something I had done for, I don't know, about 45 years. And then 2 years ago, I got promoted to doing the secretary work for the city desk.
Do you think?
Very nice to meet you. Very nice to meet you. Very nice to meet you. I would love to connect with you. Last time I spoke to him, you were only engaged. Please, let's connect and talk because there's, I always get inspired. But I agree that we need to.
What's your percentage?
I mean, especially I observe. Oh, okay, you wanna talk? I can't wait. I'll listen because, you know, and I won't even try and match you, yeah. Yeah, I felt so bad for those students, like those students.
More.
God bless them, there were 3 of them that showed up.
When I don't.
Yes, they did.
So I know. I know what you do.
No, their cause was very, very righteous.
Your existence
Coming
is
out of
absolutely
unnecessary.
unnecessary. All you just take your system from both ends.
It's hard. Because what happens is that they're in a position of advocating that I am agnostic. I mean, at best. Okay, and then, I'm talking about
So, nurse practitioner calls. I told her I was. She's like, how's your head? Because they're all fat. What do you mean?
Mistakes in good faith are fine.
3 bottles.
Okay.
Third.
No,
Exactly. That's what I was promised. When I was 35, you gave me, they gave me 3.
So yeah, we opened it with one out.
They don't want us to do because we don't generate.
And why no paper ballots? And why do you have a system that's so fucked up? I mean, Lehigh County, for all the, to run the election, right, for all the BS. At least they've got a voting system that they can whip out, you know, and run a fight, and they can.
No, but I would love to.
So you have a new, again, my name is Patrice. You have a new member in your fan club. Oh, thank you.
Really, I'm good.
That was very well done.
Oh, thank you. Yeah, April Nyberg did so much.
What's that?
April Nyberg did a lot of work. And it's delivered.
It's working exactly how it was designed to work. Correct. Correct. The entire insurance industry makes its profits built on not delivering what you're paying for. If you took your car and you got repaired and it was worse, you wouldn't pay. If you went for tires and you got 4 flats, you wouldn't pay. Or you would go, you know. With the restaurant industry is built on not delivering.
Okay, thank you so much. I'm gonna
Yes.
give that to my daughter.
I don't know how.
It just sounds bad. Yeah, and I understand it's been through it, and you did provide us so much information that I think will be helpful. Just to reassure her that there's people that are like serious. You know, they make a big more system. I just really.
Don't underestimate.
It was not a problem. They were better than the.
I think for me personally, more so than electronic communication, which is it's more phone. Every single phone call into Nancy's office is recorded. And I don't mean voice recorded, it's recorded usually on a form. Who called from where? What about? Yes, first message. You call the local office. I will listen. 30 to 60 seconds. Polite. Most of calls. The
I didn't know if you still had a
person answering.
Sure, I'm paid.
Yeah.
So I think there's like 4 there.
Oh,
This is me. I'm in the representative district.
Oh, thank you so much. No,
The other ones will just let them know.
that's fine.
To share my story. AI song. There's a 1-vote majority, I think, at this point.
One of the 5, and their daughter's going to medication. So in a situation like you do always have the right. Most of your calls that I go up about yeah. And I sort of feel, I'll be very honest, and I sort of feel when I was listening to this, basically, chance that, you know, they might overrule the local brand officers, you know, obviously, it's an arbitration process under most policies. If all of that fails, then I would call, and see if obviously I just explained your story, so like, this is what's happening, like, this is what my doctors are saying. I need this compound right now. In my situation, that's what I did. I don't have to live in NEPA. For clerical errors, where they're claiming that I did not pay the bill, and I sent them every check for that year, showing that they had cashed the checks for that year. I gave them permission to take all of that information and call it. So sometimes it's worth a shot. And
I'm so afraid we're gonna get to the point where once she graduates,